Hey everyone, it's Dr. Matthew Hernandez from Ethos Integrative Medicine, and today I want to talk about 3 reasons that your joint pain isn't getting better. So oftentimes I get patients that have come into my office and they when I start asking them questions, they walk me through the joint pain that they've been experiencing. This could be knee pain, shoulder pain, back pain, whatever it is. And they oftentimes give me a list of the different doctors that they've seen where they haven't gotten better. There are times when the patients that come in, because they've seen so many people, they're kind of reluctant to have a full trust in the provider that they're seeing now, because they were typically told that they could be helped, and they didn't get the outcome that they were looking for. They usually just didn't have any improvement at all, or very minor improvement. So what I want to discuss with you today is 3 reasons that could be happening if you've been dealing with joint pain for a while, you've seen multiple people, and you still haven't improved yet. So the very first one I'm going to discuss is actually focused on you as the patient. The other 2 are focused on the doctor. So number 1 is going to be that you're not following the instructions that the provider gave you, right? And so this can come in instances where if a provider told you, hey, you need to rest for X amount of weeks. Oftentimes, especially for active individuals, that's not a great answer to be given by a provider or a doctor. At the same time, it's usually where a lot of providers may start because it's the most conservative thing that can be done. Now, I don't necessarily believe in going to that approach. I'd rather go in, instead of watch and wait to see what happens, I'd rather actively figure out what's going on. But there are some instances where that approach does make sense, and the patient may not be getting better because they're not listening and resting. They're continuing to be active, continuing to aggravate the problem. Another example where this can come up is if we're doing regenerative medicine treatments, say prolotherapy, PRP, stem cells, all that stuff, and the patient accidentally takes like a steroid dose pack, that's going to lead to the healing process from those treatments completely stopping, and it's going to stop the tissue from healing as a whole. They'll feel great while they're on them, right? And so the steroid dose pack is going to drastically improve their pain, but once they run out of the medication, the pain's going to come back and their injury's still going to be there. So again, you don't want to be taking certain medications during those types of regenerative medicine treatments. And if you're not getting better, or if you're saying, oh, PRP stem cell didn't work, take into consideration if you accidentally took any medication that you shouldn't have been taking in that case. So that's number 1. That one's going to be solely on the patient's ability to follow instructions. I'm assuming that most of you that are watching are going to actually be people that follow the instructions that are given. So let's go into the second reason, which is going to be on the doctor. The second reason why joint pain, or why you're not getting better from joint pain, is that the wrong treatment could have been performed. So oftentimes what can happen is when you have a provider or a doctor that has a hammer, everything becomes a nail, right? And so we have instances where they'll see either a doctor, a physical therapist, a chiropractor, and the answer for your pain is going to be the same as the next 10 people that walk in the door. And oftentimes it doesn't matter what the diagnosis is, the treatment was the wrong treatment because the diagnosis was not accurate. And so this is something that I see happen quite a bit. And at the end of the day, it's really hard for you as a patient to know what the doctor's skill set and knowledge is, because again, every healthcare provider is trained in something very specific. And so again, they're given just a hammer, and very few of them will go and think outside the box of what other tools can help with this particular patient. If it's not their tool that helps, the patient's usually either dismissed or they try using the tool and the patient doesn't get any better. And so if you've been seeing a provider where they're doing the same treatment on you and it's not getting better, I would really question whether or not they're doing the right treatment in the first place. And so That's going to be the most common out of the three scenarios that I'm giving you here, is that the wrong treatment was performed because the diagnosis was incorrect or they just weren't properly diagnosed at all. The third one is going to be, again, on the doctor itself. So this is the right treatment was selected, but it wasn't performed correctly. So just like anything in this world, there's individuals that are good at things and there's individuals that do something and they're not so great at it. Not going to go as far as say as they're bad, but maybe they're just subpar, right? And so that happens it's a little scary, but it happens in the world of medicine as well, where there's just instances where a provider isn't good at treating something in particular, or they're not good at delivering a specific treatment. Either they don't have the experience, they don't have the knowledge of when to apply the treatment, just like we talked about in the last point, or they don't fully understand the treatment as a whole to understand what are the different variables that can factor into that treatment itself. And so those are things that, again, are very hard for you as a patient to really understand, what the doctor's knowledge is on that. And so when you're looking at at what you can do if you fall into this category. So again, the right treatment was performed, but you didn't get better. I would definitely go and consider seeing another provider, and don't close off a specific treatment because it didn't work the first time. So I've seen this a lot in my practice where we have people or patients who received the exact same treatment, like they did receive the right treatment, it just wasn't done correctly. They got an injection from another doctor, maybe it wasn't performed under ultrasound, so there was some guesswork on the doctor as to whether or not they were injecting the right spot. Maybe they didn't use the right concentration of platelets or of dextrose or whatever it is. There's so many variables when it comes to delivering the treatment properly that if the provider doesn't understand that, what those variables are, then it's kind of just shooting from the hip the entire time. And so you can have that happen a lot. I see it with a lot of physical therapists too. I send a patient to the physical therapist and they don't get better, but I still believe that they need physical therapy. So then we send them to a different physical therapist and they got better. The treatments were identical, like we're doing physical therapy, but how it was executed was what the difference is. And so that's really important to understand. The take home for bullet point number 3 is if you are getting treated by a provider, you're not getting better, don't completely close off the ability of another provider that has the same degree, training, etc., being able to help you, right? If it's still a potential, I'd probably go and focus on answering if number 2 is correct first. So were you given the wrong treatment to begin with? And if you have multiple people telling you, hey, no, this is what you should be doing, then realistically, the treatment is correct. You just have to find someone that's going to execute it properly. So those are the 3 reasons that your joint pain isn't getting better. Hope those help. Feel free to leave comments below.